This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted you're with us today, and today is Sunday, part of the Labor Day weekend. Guess what, Thomas? Guess what I did on Friday?
Oh, you didn't play golf out there by your office, did you?
No, but I had a virtual visit with my ophthalmologist.
Oh, and?
And it went great. He told me he's learning a lot about telehealth, telemedicine, and that he is actually doing virtual visits with many of his patients. Now, sometimes for any physician, not just ophthalmologist, you do have to come into the office. But he actually said he's becoming a little more productive the way he's doing this. And this is just a reminder to our listeners, during this COVID-19, as we're coexisting, don't put off medical treatment. Continue to communicate with your healthcare providers.
That's such an important message, and we're going to theme that kind of through this segment here. But I'm curious, when I think of ophthalmology and really encountering your doctor, that's something where, of course, he has $1 million worth of equipment there to test our eyes. How do you do that virtually?
Well, this is what happened, believe it or not. They segregated all the equipment into a different area of their office. They physical distanced it, and I actually came in, and it was spaced appointments where a lot of the tests were done on my eyes, and I left. He then got the results of the test, and rather than me come back, he talked to me virtually and went through that. So I did have to go to the office, but it was handled in a very safe way to prevent any type of COVID-19 spread.
Wow, that's interesting. So was that your first encounter virtually since all this began?
I've had a couple of virtual telephone conversations with providers, but that was probably the first more comprehensive one.
Are you a thumbs-up fan?
Absolutely. I think that there is so much value in looking at telehealth, telemedicine, virtual visits. I think that we can learn a lot where you become even more efficient, and at the same time, you do it in a very safe way. The main thing, though, Thomas, is don't let COVID-19 keep you from seeing your providers, and don't be afraid, as we've said on the show before, to call 911.
Well, who would have imagined back in January when we were celebrating New Year's that by Labor Day we would be wearing masks and social distancing from each other? How are things looking this Labor Day weekend from your perspective in the hospitals?
Well, here you go, Thomas, and this is my take on it. The people, especially here in North Texas, deserve so much credit. The people and the businesses have been very conscientious in following the recommendations of public health. And as a result, over the last 4 to 5 weeks, we have really tapped down the amount of COVID-19 spread and the census in our hospitals. However, Thomas, the census of COVID-19 patients in North Texas hospitals today is just about where it was at the end of May. So we're back to where we were at the end of May because we had that big increase, as you know, in the middle of June and late June rolling into July, and that was a result of behaviors on Memorial Day. So let's learn a lesson. We're right back to where we were at the end of May. Let's don't let Labor Day become Memorial Day and we increase community spread.
Boy, I've got a couple of takeaways in my mind from what you just said. Number one is, from the report that you just gave us, I just think of all the shows that we've done since this broke out in March, and what everybody that we've had on as a guest on here has said, you just confirmed worked.
Absolutely. Wearing a mask, physical distancing, washing your hands, good personal hygiene. These are the tools that we have to fight the spread of COVID-19.
Now, my second takeaway is this. If we relax those and we get sloppy and we stop doing those things, we'll be back to where we were.
There's a darn good chance of that, and we don't want that to happen. And that's why I'm saying Labor Day cannot be Memorial Day. You know, Memorial Day, I think a lot of people went out and about, which is certainly understandable. I know people had cabin fever. They had been sheltered in place, etc. Many didn't wear masks. Many probably went out to larger groups than, say, 10 people. And as a result, it spread. It can happen again. Again, I remind people, our hospitalizations and census today is exactly, for the most part, where it was at the end of May. And we saw how quickly it spread in June.
Now, the other thing, and your story about your virtual visit kicks this off. How are the hospitals doing as far as back to speed? Are they as back to speed as they're going to be while COVID is still a threat? And I'm asking from this perspective, getting routine care. I have a friend who was recently diagnosed with colon cancer, and there were some complications around that because of COVID-19. Point is, if it could have been treated a little sooner, so we really need to not put off routine care.
Absolutely. We don't need to put it off, and hospitals are there. They're ready to treat you. The physicians are there, and many people are now beginning to come back. They're coming back and getting the care. I actually saw an article where the Kaiser Family Foundation said at the end of March or early April, 48% of Americans had put off their care because of COVID-19. Now, that's coming back, but it's not back to 100%, but we're trying to get there.
So we're back from Labor Day. We're back from any summer traveling and vacationing that people have done in whatever way they've done it. Would this be a great time to start scheduling that routine care and put that on your early fall checklist because it probably has been set aside for most of this year?
Yeah, it's two things to put on that checklist. Go ahead and schedule all necessary medical visits with your provider. No question about it. Number two, if you hadn't gotten a flu shot, get your flu shot. We're into September now. Now's the time to get the flu shot. Can I pivot on you just a minute, Thomas?
Well, certainly.
The reason I say this, it's kind of the last hurrah. It's the end of the summer. It's Labor Day. Based on what we've heard from professionals, watch your kids around water. If they're at a lake, if they're at a river, or if they're at a pool, we don't want a drowning. Watch those kids and be safe.
That's a great point, Stephen. 2 shows ago, we had Jesus Alderete from Children's Health with us talking about water safety. So perfect reminder here about our podcast. If you would like to go back and listen to that, he had some amazing information. I agree with what you're saying, that if you have young children, you should go back and listen to that because it will make you think of some things that you wouldn't have otherwise thought about.
So please stay with us. We've got 3 great segments coming up. We're going to talk about a great safety program in South Dallas, Mothers Against Drunk Driving, especially this Labor Day weekend. And Beth Warren from Children's Health is going to wrap up the show on a very high note.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome to the human side of healthcare. Today, we're going to talk about a program that's called Right Care. And this is a program that I think our listeners are going to find quite interesting. And we couldn't have a better person to discuss this than Kurtis Young. He's the Director of Social Work, Behavioral Health Services at Parkland Health and Hospital System. Kurtis, thanks for joining us.
Thank you for having me, Steve. It's an honor to be here. I appreciate it.
You know, we hear a lot about topics and our listeners hear Right Care. So what is Right Care? Can you kind of explain this program?
Sure, absolutely. So the Right Care team is a first responder pilot program that was launched back in January of 2018. It was basically through a Caruth Smart Justice grant that was obtained by the Meadows Mental Health and Policy Institute here in Dallas. And they basically built this partnership between Dallas Police Department, Dallas Fire Rescue, and then they brought Parkland Hospital on board to kind of bring all these partners together to put a patrol officer, a paramedic, and a social worker in one vehicle with the intention of responding to 911 mental health calls as one unit. And so and the intention there is to try and do a better job of responding to health crises in the community. Now, Right Care also has a kind of a second arm to it. So the response call is one, but then there's also a social worker from Parkland stationed in the 911 call center for the city of Dallas. And that social worker is there 5 days a week, 16 hours a day, to assist call takers, police officers, and citizens who call in that have mental health crisis. They need resources, kind of some coordination of care efforts going on there, as well as prioritization of resources. So trying to get the right people to the right places.
You know, Kurtis, when you think in terms of these programs and having social workers and the 911 and looking at behavioral health issues, here, as you know, at the Hospital Council through our foundation, we have a lot of data. And about a third of the people that show up at our emergency rooms have some type of behavioral health issue. So I know there's a need for this program. But to our listeners, can you expand a little bit on why there is such a need for this program that you have?
I think mental health in general is kind of more on the forefront of people's minds these days. There's campaigns out there, especially from like Mental Health and Policy Institute, that it's okay to say, meaning it's okay to talk about this thing that we haven't been able to talk about for so many years prior. And as that kind of comes to light and people feel more comfortable talking about it, I don't necessarily think that more people have a mental health issue. I think maybe it's that people are now okay to talk about it a little bit more and are seeking help for it because we've allowed them to do that as a society. There was a lot of motivation for it in the different agencies. So, Dallas Police Department saw that they had ways that they could improve how they responded to mental health needs in their community. So there was motivation there to do something different. Parkland also had a period of time in 2011 and 12 when they had some challenges and were very internally focused on improving their own quality of care. And once they kind of fixed, they kind of turned toward the community and said, now let's focus on doing more community work. So this all fell right in line with that to provide better mental health care for the city of Dallas.
So as we look at Parkland and the work that Parkland's doing, how would you best describe the role that Parkland, its psychiatric social workers, integrate into this and a part of the Right Care team?
Sure. If I can go through each of the kind of roles of the people that are part of the team. You've got Dallas Police Department Patrol Officer, which really focuses on scene safety and making sure that that's a safe area for everybody that's there. Then you've got the Dallas Fire Rescue Paramedic, and they're doing a medical evaluation, making sure that there's no medical crisis happening. And so once those are kind of completed, then the Parkland social worker can come in and do a psychosocial assessment and a risk assessment to see, what's really going on here and what are the needs of the citizen. It might be somebody who's in a more of a mental health crisis, like feeling suicidal, but there might be some psychosocial needs in there, like a housing or a conflict with a roommate that has kind of escalated. And so maybe it's more conflict resolution that's going to happen on scene. But it might also be that they've run out of their medication and they're not feeling very well. So we have some great partnerships with Metro Care Services to do same-day appointments so that we can take them to go and see a psychiatrist or a mental health provider and maybe even get their medication that day. There's a variety of tools that we can use, but it's a Parkland social worker that's kind of coordinating a lot of those efforts with the resources within the community.
You mentioned the Dallas Fire and Rescue, the paramedics, and the Dallas police officers are involved. So in looking in terms of Dallas, are there specific areas within Dallas that you serve?
Yeah, the pilot program was very specific for the grant-funded period of time we've been operating to be in just South Central Dallas right now. And there's the South Central Patrol District for the police department, and that we just kind of operate within those geographical boundaries right now. It's kind of south of downtown Dallas, and then on the west you have Highway 67, and on the west you have Interstate 45, and on the south you have Interstate 20. It's kind of everything in that kind of triangle right there is where we're serving right now.
And I know you talked about this was kind of a pilot program and it's been in place. Has it been operational long enough that you could share some of the results that you've achieved so far?
Absolutely. So we have been in operation since January of 2018. And some of the results were almost immediate. Within a couple months of us kind of getting off the ground and getting going, we saw pretty impressive results almost right out of the gate. So since 2018, we've responded to over 6,000 911 calls. Of those 6,000, we've diverted 30% of those calls from going to busy medical ERs or going to jail. In fact, our rate of incarceration or taking folks to jail is right around 4% is all. And we find that pretty astounding, considering the police officers would typically, if they needed to take somebody that was in crisis somewhere, jail was one of the prime options for them prior to the Right Care team. And so to see that we're only taking 4% of folks now is really, really positive. Because one of our goals is to decriminalize the mental health system. So that's definitely not where we want to be taking people as jail when we can help it. We've also connected over 1,000 people to mental health services, and we're following up with folks on a very regular basis. So even if we don't feel like they necessarily qualify for services or they don't need to go to the ER or a hospital just right now, if we're a little concerned about them, we might check on their minds over the coming week after we initially see them to make sure they're doing okay and kind of provide a support for the citizen, but also maybe their family or the people they're living with to just kind of make sure that things are going okay.
You know, Kurtis, you bring up some excellent points, and those results, the 4%, I mean, that is astonishing. That is terrific work. Many of our listeners may not realize it, but, you know, you do want to keep these people from being incarcerated. You want to keep them from going to jail. The other thing, and most people may not know this, but when you keep someone from going to an emergency room, especially emergency rooms that may not have a hospital with a psychiatric unit or the capability, sometimes they have to board that patient. And then the hospital has to work through the social workers and placement to find somewhere for that individual to go. So it's really kind of a hardship on the patient, and it's a hardship for the hospital. So this is tremendous work that you're doing. So with those kind of results, are there any plans to expand this program?
Well, thank you very much, Steve. We do have plans to expand. Even though the pilot program itself ends in just in a couple months here, there's no plans to discontinue the program after that pilot. In fact, it's popular in every agency, all three of the partner agencies. So the City of Dallas, Parkland Health and Hospital System, they're both, as well as the North Texas Behavioral Health Authority, are partnering together to not only continue the work that we're doing right now, but to expand it to 3 teams that will go citywide. We hope to expand that within the next year, hopefully by the end of this calendar year, if at all possible. But with the current state of things right now, we with the virus going around, we have to kind of be careful there. But yeah, we are looking at expanding to 3 teams citywide.
Well, you know, that's tremendous that you'll expand this into 3 different teams. Kurtis, you know, we could continue this discussion, but our time is running short. But on behalf of the Hospital Council, on behalf of our member hospitals, and obviously on behalf of the human side of healthcare, thank you so much for taking time to be with us today.
Thank you, Steve. I would just like to say in closing that this isn't possible without the people who are out on the front lines, patrol officers, the paramedics, and the social workers who are seeing those folks every day to make this a better community. So thank you to them. And I appreciate it, Steve. Thank you.
This is just one of the many ways that our local DFW hospitals are involved in the community in ways that you would never think of. Thank you, Kurtis, for telling us about that incredible program that has become so much more valuable in 2020. Now, when we come back, it's of course Labor Day, and that means some parties and some drinking, which can get out of hand. Mothers Against Drunk Driving next on the human side of healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome to the human side of healthcare. Delighted you're joining us for this segment. You know, it's Labor Day weekend. We want people to have fun. It's the end of the summer. And yes, sometimes drinking alcohol is involved. Please drink responsibly. And if you do drink, don't drive. We don't need fatalities, injuries, and car wrecks as a result of drunk driving. So let's make this a very safe weekend. Joining us now is Ron Sylvan from Mothers Against Drunk Driving. Ron, welcome to the show.
I'm happy to be here, Steve.
You know, Ron, a lot of people have heard about MAD, and we have a lot of people that may say, what really is the true mission of Mothers Against Drunk Driving?
Sure. It's a great question. We are here to eliminate drunk driving and prevent drug driving and underage drinking. So it's a multifaceted mission, really focusing on a crime or crimes, if you will, that happen to be 100% preventable.
As you've looked at MAD over a number of years and the work that's been done, what would you say are some of the greatest accomplishments in your mind that MAD has done?
Well, as you know, Steve, in 2020, we're celebrating our 40th anniversary. So during the past 40 years, we have accomplished many milestones, but some of them at the top of the list would be raising the drinking age to 21 across the country, establishing the BAC at 0.08.
Now, BAC, blood alcohol content?
That's correct. That's correct. So that's the legal measure that people are either considered to be impaired or not. If they're at 0.08 or above, they're impaired. And since we accomplished all of that, actually last year, Utah lowered their BAC to 0.05. That was a very important accomplishment for us too, as well as now looking at 33 states plus Washington, D.C., having all offender interlock laws.
You know, those interlock laws make a lot of sense. And can you explain to our listeners a little bit about how that works?
Sure. What happens is when an offender has been charged with a DWI, the courts have an option, and in many states, as I just mentioned, not much of an option in terms of the offender's perspective. They are ordered to have an interlock device installed in their vehicle. The device is one that requires the offender to blow into the device to determine whether he or she has any alcohol in their blood system. There's also a very sophisticated camera attached to it so that one can't have someone else in their car blow for them. And if it's detected that there's alcohol in their system, the car will not turn on.
You know, we hear, unfortunately, routinely here in North Texas about a wrong-way driver that's on the toll road or on 635 or on I-30. Doesn't really matter. And I'm not prejudging, and I'm certainly not saying that every one of the wrong-way drivers were driving intoxicated. But many times, as the police unfold and investigate what happens, there's usually an impaired driver that's involved. How do we deal with that? How do we deal with wrong-way drivers? Is there any kind of device or anything we can do that could prevent that?
Yeah, that's a tough one. That's a question that I am presented with on a regular basis. The solution ultimately is going to have to probably have several different elements: signage, devices that could be planted onto the highway to prevent vehicles from entering an on-ramp or an off-ramp in the wrong direction. Technology that is very costly, and I think is one of the reasons we haven't seen more of this happening, certainly anywhere in the country and here in Texas in particular. So I think we're still dealing with that. Hopefully we'll find the answer here soon.
Yeah, and the reason I bring that up, as I mentioned, hospitals see the result of drunk driving frequently. And unfortunately, many times death occurs or there's trauma where we come to trauma units. In fact, I have a good friend of mine that's in emergency management. He has 2 teenagers. He won't let them drive on weekends after 9 p.m. because of what he sees and because of the drunk driving. So let me just ask you the tough question, but our listeners need to know this. In North Texas and in Texas, how do we stack up against some of the other states related to drunk driving?
Well, that's a great question, and my answer is going to be very depressing to your listeners. Dallas County is second only to Harris County, which is Houston, in the number of drunk driving crashes that take place annually. But if you look at DFW as basically a 4-county area, Denton, Collin, Dallas, and Tarrant County, there is no other location in the entire United States where one is more likely to be hit by a drunk driver.
Wow, that is interesting. That 4-county area you just described is one of the most dangerous in the nation.
You bet.
Wow. You mentioned the 40th anniversary of Mothers Against Drunk Driving, and I know you do a lot of good work here locally. What are some of the things for 2020 that you think will make MAD special? And then more specifically, elaborate to the extent you'd like on some of the local events.
Sure. Well, we do an array of activities, some for the purpose of raising much needed funds so that we can continue to provide services to our victims at no cost, and others just to recognize the hard work of many of our partners like law enforcement in their battle to also eliminate drunk driving. So annually we do 2 luncheons. We call them law enforcement recognition luncheons. They're not fundraisers, but they're attended by a couple hundred people. And we recognize law enforcement officers in both Tarrant County and Dallas County for their efforts in eliminating drunk driving. So we will recognize them for the number of DWI arrests, creativity in establishing educational programs that are spread throughout the community in our schools, and things such as that. So we're very proud of the fact that we're able to recognize these folks that are boots on the ground every day, risking their lives to take drunk drivers off the roads. Our signature fundraising event is called Walk Like Mad. Here in this area, we conduct it once a year at Lake Carolyn here in Las Colinas. This coming year, our date is June 27th, and we encourage anyone in the area to come out and support our efforts, walk with us. We have many, many victims and their families that participate in this event. It's part of the healing process. It really raises awareness in terms of the issue of drunk driving, and very importantly, raises much needed funds for our efforts to provide services to those victims.
You mentioned victims, and when you look at drunk driving, and unfortunately when you look at people that are involved in a death associated with drunk driving, there's not just a single victim, there are multiple victims. And I know Mothers Against Drunk Driving does a lot of work with Victims Impact in helping the families that have lost loved ones. Can you elaborate a little bit on Victim Impact work that you do?
Sure. The bulk of our staffing is all geared towards providing victim services. And as I mentioned earlier, we provide those services at absolutely no cost to victims. So we have an array of things that we offer. We will accompany families to their court proceedings. Many times families are confused, they're intimidated by the court system, and it's very helpful for them to have an advocate at their side to help them meander through the system. We help them fill out paperwork for victims' compensation, if that's something that is in order, provide support groups. We have a 24-hour nationwide hotline for any victim that wants to simply talk or needs some of our services. We go out and we speak to middle school and high school children about the consequences of underage drinking. And when we do that, we always, without exception, run into teachers or parents who themselves are victims. Statistics show that 2 out of 3 of us at some point in our lifetime will be impacted by a drunk driver.
2/3.
2/3.
Wow. Well, Ron, all I can say is on behalf of all the hospitals, and, we've named this show The Human Side of Healthcare, and I think the work that you're doing to prevent drunk driving, the work that you're doing to, unfortunately, have to help victims that are impacted by drunk driving is just laudable work. And hospitals, certainly through our emergency rooms, trauma units, trying to help educate the community, applaud you on those efforts, and we stand ready to work with you in any way we can. Thank you for being on the show.
Thank you, Steve, for helping us raise awareness to the issue of drunk driving.
Thank you, Ron and Steve, for a great reminder on a holiday weekend. If you've ever known someone who has lost a loved one to a fatal drunk driving accident, you know how important this message is. And come on, why would you like to have your car locked off for a whole 2 years? Just best to not go there. When we come back, we're going to shift gears. Beth Warren from Children's Health on mindfulness, wrapping up on a high note on the human side of healthcare. Stay with us.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the human side of healthcare. We're delighted you're with us today, and we have a very important segment that we want to talk about. Yes, it's called mindfulness. And we couldn't have a better person than Beth Warren. She's a clinical therapist at Children's Health. And Beth, welcome to the show.
Thank you. I appreciate it.
What is mindfulness?
Mindfulness means maintaining a moment-to-moment awareness of our thoughts, feelings, bodily sensations, and surrounding environment through a gentle, nurturing lens. When we practice mindfulness, our thoughts turn into what we're sensing in the present moment rather than rehashing the past or imagining the future.
So let me ask you this. As you look at the components of mindfulness, could you break those into different categories? Or what are your thoughts on as we examine mindfulness?
Sure. There are usually 3 components of mindfulness. The first one being attention, and that is just mindfully paying attention to your inner and outer experiences in the present moment. The second part is intention, and your intention is what you hope to get from just being in the present moment, whether it be reducing your stress or trying to find peace in the present moment. And then the last component is our attitude. Mindfulness plays a really important component in attention to the way we see things and our curiosity and acceptance and our kindness that we give ourselves.
That's some good advice. And, you mentioned practicing mindfulness. What kind of training do people need?
Really, you don't need any kind of specific training. It is nice to have a mentor or an instructor in the beginning to just kind of help you get used to it. But basically, the only practice you need is time and quietness so that you have a chance to just quiet your mind and get still for a minute. There are specific trainings that you can do, but most of them are a little expensive, and for the most of us, that's kind of out of our budget. So just taking a minute to get quiet and take some good deep breaths is the simplest way to practice mindfulness.
What are your thoughts on how you would advise our listeners to enhance mindfulness?
Mindfulness doesn't really require you to change anything about yourself. Basically, what you're doing in mindfulness is just truly paying attention to the way you think, the way you feel, the way your body reacts to everything. Mindfulness recognizes and cultivates the best of who we are as human beings. The most change that you have to do is just making time to do it.
What is one simple technique that we could use?
Probably one of the easiest techniques I teach is called GLAD. It stands for grateful, what I learned, what I accomplished, and what I delight in. So every day you do a GLAD technique. So you're going to say one thing that you're grateful for, one thing that you learned today, one thing that you accomplished today, and one delight you had. So for example, a grateful thing that I am today is for the beautiful sunrise that I saw this morning. One thing that I learned was I was able to learn a new app on my phone. One thing I accomplished today was not skipping a meal. And another delight that I had today was noticing that all the spring flowers and the trees are all starting to bud. So it's a real simple technique that you can do before you go to bed at night or anytime during the day. Just take a minute and just look at the 4 things and be able to answer those for yourself.
From where you are as a clinical therapist, what would you consider the ultimate goal of meditation?
I would say probably the best goal is reducing your stress and your anxiety and just finding joy in the day by slowing down and taking time to just recognize where you are and what your surrounding and your environment is, and just practice gratitude. That is one of the best mindfulness techniques you can do.
You know, as I listen to you, and I'm thinking in terms of many of the listeners are probably at home, and, you know, some of these techniques that they could be using at home where they feel more constricted than they normally are would be very worthwhile. And meditation would be one of those. Would you agree?
Yes, definitely. Meditation is one of the mindfulness practices that you can do. You know, mindfulness is just truly, and so is meditation, truly just being aware of your breath and your surroundings and the stillness that goes with it. So, you know, we live in a very fast-paced society, and a lot of times, you know, we're just on the go all the time. So making time to just slow down for a minute sometimes is really all we need to do.
And you know, you're a therapist at Children's Health and get to work with our blessed children and such assets to us to have such wonderful children. Unfortunately, sometimes children have disabilities, etc. So I can only imagine that mindfulness would really help when you're a caretaker or a caregiver. What do you think in terms of that?
It is. It's one of the probably the best self-care techniques that we can teach our parents is how to be mindful and to just really take some good care of themselves, because as a caretaker, it is stressful and you're usually on 24/7, 365 days a week. So learning how to put a few simple mindfulness techniques and practices into your day, it makes you a calmer person and helps you be able to handle all the challenges that come with special needs parenting.
Beth, let's bring this home to what people are dealing with today. So if you quiet your mind, one of the things that this self-isolation can do is cause that mind to absolutely go running with all the uncertainties and the bills and the income that isn't coming in. And so many people are faced with enormous challenges from this. What do you recommend for them?
I think probably first and foremost, it's hard to turn off that anxiety when I am possibly going to lose my job or am not being able to be around other people. So I think one way you can practice mindfulness is just to give yourself a second to acknowledge that the fear is there, to label it, to name it, so that we know where it's coming from. And then that way we can combat where is it coming from. Is it unrealistic fear? Is it real fear? Where do we go with this? And a lot of times when we get quiet and we name an emotion, a lot of times that settles us down because we know where it's coming from. It doesn't, always solve everything, but at least I know where I'm at and what that emotion that's rising up inside of me could be causing extra anxiety or extra stress.
Are you seeing this become more popular in our culture?
I think yes. As we're coming up, we're seeing more and more people practicing it and realizing the benefits of it. I think there are several more corporations that are starting to incorporate it, so I think that's a good sign. And we've seen what the benefits are of mindfulness. It does reduce our stress. It does reduce our anxiety. It does reduce pain and reduces depression and high blood pressure. And, it improves our attention. There's so many benefits to it. And I think the more we practice it, the more people will realize that, wow, this was really beneficial.
Thank you, Beth. We really appreciate those comments. Beth Warren from Children's Health talking about mindfulness. Good thing to remember on a Labor Day holiday weekend, Steve.
Absolutely. We want to be upbeat on Labor Day. And Thomas, the final words that I'd like to say is get that flu shot, wear that mask, physical distance, wash your hands, and have fun. We're all in this together, but you know what? We're going to get through it. Have a great rest of the Labor Day weekend.